And I think we're live. We have everybody. All right, y'all. Good evening, everyone, and welcome to another Live with Dr. Dawn. Thank you so much for joining us this evening. It has been an amazing last 3 days. We've had so many physicians on and talking about topics in relation to their specialties and surrounding the COVID pandemic. And I am so excited about tonight's broadcast, for real. I mean, I know y'all can see the view that I'm looking at right now. This is a beautiful view. These are 12 Black African American board certified doctors from all over the country, y'all, all over the country. And they actually came to be a part of this roundtable so we can talk about some of these issues that you brought forth in relation to COVID. We may be talking about some other issues too. So please, before we start, why don't you share this broadcast with at least 5 of your friends? Go ahead, you got time. Share it with at least 5 people that you know need to be here right now. I'm talking about your husbands, your sons, your aunts, your uncles. Share it with everybody, y'all. Now you have access to Black African American doctors that are men. You may want to have everybody come into the room. All right. And I'm going to actually have them introduce themselves. So I'm going to start with, let's see here, Dr. Brad.
Hey, Dr. Dawn, can you hear me?
I can.
Okay, good deal. First of all, thanks for having me on. It's definitely an honor to be amongst some very inspiring brothers here on this call tonight. So I appreciate it. I reside here in Dallas, Texas. I serve as a double-boarded physician, both emergency medicine and sports medicine. Ironically enough, I'm not on the front lines in the ER anymore, but most of my medical practice is non-operative sports medicine. And so I help active individuals with joint pain by using regenerative medicine, stem cell, and some other new biologics to be able to help them get back to doing what they enjoyed doing without nearly as much pain and to be more functional. And then outside of that, I have a performance coaching company where I coach high achieving men to be able to pursue their purpose so they can live a fulfilled life without compromising their career or their personal well-being.
Awesome. Thanks, Dr. Brad, for being here.
Thanks.
Dr. Donald.
Good evening, everyone. First of all, thank you, Dawn, for allowing me to be a part of this amazing panel. My name is Donald Brown. I am trained in internal medicine and also, in inpatient psychiatry and forensic psychiatry. I'm full-time inpatient psychiatrist at Metropolitan State Hospital in Los Angeles, California. And I'm a part-time forensic psychiatrist where I do private evaluations, going into local jails, specifically Twin Towers Correctional Facility, which is actually the nation's largest inpatient psychiatric hospital. Which is sad, but true. My experience with the COVID situation personally, it's kind of a tricky one because I'm kind of on the line where I do have to go into these pretty high risk areas. A lot of patients and frankly, the inmates that I do see don't have the ability to leave their current situations due to their illness or due to their legal issues. So as far as my contribution to this panel, I wanted to speak a little bit later about dealing with what everyone else is going through psychiatrically, but also trying to find out solutions of where we can go from here, considering the times we live in now.
Thank you. That's my brother, y'all. I'm so proud of him. Next, Dr. Nee.
Hey, Dr. Dawn, thanks for having me on. And congratulations for putting together such a great panel. I'm excited to be here. How's everybody doing? So my name is Dr. Nee. I'm a board certified general surgeon, but I also practice in trauma, critical care. One of the things that I'm really proud of is taking care of people at their worst when they least expect it, from the ER and from the opening doors all the way to leaving the hospital. But I also host a podcast called Docs Outside the Box. It's a podcast about ordinary doctors who are doing extraordinary things outside of medicine. And from there, I've developed a passion into helping other doctors, find their passion in medicine and passion in healthcare with their voice, with podcasting. So I coach other doctors on podcasting. And I'm just here to add my 2 cents on the trauma critical care perspective on COVID-19.
Thank you, Dr. Nee. Dr. Pierre.
All right. All right. Good evening, everyone. Dr. Perry. Oh,
I'm sorry.
is there two Pierres? Oh, wow.
My bad, y'all. Dr. Pierre Johnson.
Okay. All right.
I was right. I was good. All right. Thanks for having me, Dr. Brown. I appreciate both Dr. Browns, XU representing. I am, Dr. Pierre Johnson. I'm a board certified OBGYN. I specialize in minimally invasive surgery, specifically Da Vinci robotic surgery. And my perspective will be on COVID as far as pregnancy is concerned, and as far as the impact on women's health and it's having currently. I am 1/3 of a group called Pulse of Perseverance, which the other gentleman, Dr. Madir, is a part of as well. And our fight is to change the negative stereotypical image of the young Black male. So we're the 3 doctors that have been on that journey, for the past 2 years that have been like all over talking and public speaking and doing all of our work to try to make people see us in a different light. This panel is very powerful, speaking to that, just to see all of us as Black men changing that stereotype and that perception is huge just for the world to see. So I'm very proud and honored to be a part. And on the solo tip, I'm also about, eradicating healthcare disparities. So Doc P, Doc for the Streets. I am will be launching my own podcast, like Dr. Darko, which is called Doc for the Streets, which is doing just that, which is aim to eradicate healthcare disparities and educate our people more about their health and their options as it relates to the things that are going on in our society and our world. So glad to be here. Thanks for having me.
Thank you, Dr. Pierre. Dr. Thomas, AKA TJ.
Hey everybody, thanks Dr. Don for having me and thinking enough of a low Morehouse man to be assembled amongst all these fine Xavierites. I'm very inspired and very humbled to be amongst all of you all. I hear about how great Xavier is every day from my wife, and seeing is believing, and y'all definitely are a rare breed, and it's good to see. I'm an orthopedic spine surgeon. I specialize in care of patients suffering from structural abnormalities in the neck or in the back involving the spine. I specialize in general in minimally invasive spine surgery and take care of patients who have not only neck or back pain, but also patients who have pinched nerves that cause debilitation regarding their function with respect to the lower and upper extremities. And located here in Houston, Texas, I'm a solo practitioner, small business owner, and still here breathing and happy to be part of the panel tonight.
Thank you, Dr. Thomas. Dr. Will.
Hey, Dr. Don. Hey, everybody. I'm Dr. Will, internal medicine board certified. I went to school with Dr. Don. We were classmates at SLU. I'm a hospitalist. I'm the medical director of the hospitalist service at our facility, Atlanta Medical Center South Campus. Patients and nursing home patients. My experience with COVID is pretty much on the front line. Well, I call it the second line. I call the ER the front line, but I admit the patients, treat them during their hospitalization, and I try to get them home. So that's what I have to offer today. I'm really appreciative to be invited to this panel today.
Thanks, Dr. Will. Dr. Matz.
Good evening, Dr. Dawn. Thank you again. I don't want to echo what everybody else has pretty much said already, but of course, it takes a strong Black woman to set up something like this, so we appreciate that. My name is Dr. Maxim Adair. I am an anesthesiologist, so specialized in cardiothoracic anesthesia. I'm a partner in a private practice down here in Baton Rouge, Louisiana, Our Lady of the Lake Regional Medical Center. To try to just sum up everything, pretty much right now, we are, I wouldn't necessarily call us the front lines, but we are in heavy conversations with our hospital right now. It's really serious down here in Louisiana. As of right now, we have over 40 patients intubated on the ventilator due to COVID-19. So our role is just to kind of serve as a support system for the ICU physicians who are really going through it right now. And they're just trying to maintain some type of sanity in the midst of all this madness. So outside of my role as a cardiac anesthesiologist, I want to just mention what Dr. P had said about the Pulse of Perseverance. We are brothers and partners in that nonprofit organization. And just part of our mission, of course, is to empower and inspire young black youth for working towards their goals and achieving the highest level possible. We do that via the form of monthly scholarships. And in the future, we will have a platform where we are trying to connect brothers such as yourselves with mentees and just take it to a national platform. So that's going to be in the works. It's the app is done. Right now, we're beta testing it right now. So we'll be looking forward to working with a few of y'all in the future.
I love it. That's wonderful. Congratulations, you guys.
Thank you.
Yes. Dr. Serge.
Hey, Dawn, Dr. Dawn. Definitely thank you for inviting me on this distinguished panel of MDs. I'm the lowly DDS here, so hopefully I got something insightful to say. But thank you guys. We definitely want to say thank you for everything you guys are doing in the hospitals. I know, there's nurses and other ER doctors, but I know you guys are still dealing with a lot of these patients. So from the DDS community, we want to say thank you. I went to school at Xavier with Dawn, Xavier University of Louisiana. I'm a practice owner, dentist, deal with cosmetic, kind of focus on reconstructive oral rehabilitation and implants. But I also focus really, my past 2 years, I started focusing on the whole oral systemic link between, chronic gum disease and how it has effect of a cascade of other chronic diseases within the overall body, where you're talking about like diabetes, Alzheimer's, not so much, other things such as other chronic diseases. There's not so much focus on where there's like a link or causal, but there's some linkages in certain toxins that can create and has an effect. So sometimes I know people come to the dentist first before they go see the MD. So things we could catch on, make sure we refer into the medical system. That's what we kind of focus on. COVID, I own a practice dentist of Fort Bend County, Richmond, Texas, which is a suburb of Houston. So yes, there's a physical aspect, there's a health aspect, and there's, as a practice owner, there's a financial aspect to it. So we're just trying to find a way through all this. And I think my background, I was a director of dentistry, or I should say general dentistry at Harlem Hospital in New York City. And I was part of the public health system working in the hospital. So I feel like I'd have something value to bring in the private practice world. The ADA, nobody really knows what's going on, even though every day you guys finding out new things. So the ADA March 16th let something out. So I know a lot of dentists closed down, where I felt like my public health background felt like I still want to be there, because we know about 30% of emergency room visits are because of dental cases, and you guys are overrun and overwhelmed by some of all this going on right now, that any part I could play where you could focus on the more important things with people who are have some type of disability, I want to just play my part. But thank you for allowing me to be here.
Thank you for being here, Dr. Serge. Appreciate you. Dr. Stephen.
Hey, Dr. Don, to the rest of the gentlemen on the panel, to the audience out there, my name is Dr. Stephen Noble. I'm a board certified cardiothoracic surgeon, which means I specialize in the surgical treatment of the #1 killers of Americans, which is heart disease and lung cancer. I have a particular focus in robotic assisted surgery for lung cancer, catheter-based treatment for structural heart disease, as well as standard open heart surgical techniques. In addition to being a full-time CT surgeon, I serve as a clinical advisor for 3 startup companies, and I am a producer for an upcoming documentary, Rise Up, Black Men in White Coats. I appreciate being on this esteemed panel. Thank you, Dr. Don, and thank you for the rest of the gentlemen out here.
Thanks, Dr. Stephen.
So you know Dale.
Oh, yeah.
Yeah.
He was there. We was there. Max at the thing.
Oh, okay. All right, cool.
He was in Chicago. We linked up.
Word. All right.
Dr. Eddie.
Hey, first of all, Don, thank you so much for inviting me to join this panel. I'm so proud of you and all your accomplishments and with your social media platform. So I'm just glad I was able to make the panel, this distinguished panel here, and excited to be here. I'm a board certified neurologist in Houston, Texas. I specialize, general neurology, but also specialize in neuromuscular diseases such as ALS, myasthenia gravis. Aside from that, I also received, got an MBA. And from a business standpoint, my interest is in medical startups, consulting with medical startup companies, as well as helping to seek funding for medical startup companies. Part of what or my particular interest with COVID is in how is this changing medicine as we see it today? Part of the focus that we look for, the companies we look for, have to do with digital health and telehealth. And, we're going to see a huge range now of remote monitoring, telehealth, and medicine. So that's a particular interest of mine in how we look at this crisis.
Most definitely. Thank you, Dr. Eddie. Dr. Berry.
All right, let me unmute myself. All right, guys. First of all, Dr. Don, thank you for inviting me. I'm definitely excited and empowered, just by being a part of this panel of just amazing gentlemen doing some amazing things. Like I said, I get hyped being around Black physicians probably more than anybody. So just to be able to kind of see us kind of all here is definitely an amazing sight to see, especially for such an amazing topic, an important topic, really, especially as from a public health background that I have. And I'm a program director for internal medicine residency program. So we're all kind of learning this process and teaching this process. And not only are we having to teach my attendings, but I'm also teaching residents. And before we had to kick the medical students out, the medical students of such an important disease that I'm just happy to be talking about today. Again, I'm Dr. Barry Pierre, board certified internist. I'm a hospitalist, program director, medical director, host of the Lunch Learn with Dr. Barry podcast, host, my mentor, Dr. Nee Darko's on here as well too. He definitely helped push me to drop the podcast, really to help educate our community on all things health related. So I'm just excited to be here today.
Thank you, Dr. Berry. And last but certainly not least, Dr. Bryant.
I'm mute myself here. All right. So first and foremost, look, I feel blessed and honored to make the cut. Thank you, Dawn, for having us all on here. As it is Doctor's Day, let me wish you all a happy Doctor's Day. I appreciate each and every one of you brothers for the time and work and effort that it takes to get to where we all are. So I'm Dr. Bryant Pryor. Board certified internal medicine, practice as a hospitalist, turned consultant, internal medicine consulting, prior internal medicine residency director for IU Health Arnett Hospital up in Lafayette, Indiana. Now I'm down in Houston, Texas. So I've moved around just a little bit. I am also a small business owner as well. My passion is in travel medicine, and my consulting work serves to help shape the systems to respond to things like COVID-19 and how it affects specifically, first and foremost, our community and also how it impacts us as Americans. So that's the long and short of it, guys. Thanks for having me on here.
Thanks, Dr. Bryant. And I'm Dr. Dawn Brown, double-boarded certified child, adolescent, and adult psychiatrist. I'm a two-time best-selling author, podcaster, public speaker, and media influencer. I actually am the CEO and owner practitioner of two private practices, one in Houston, Texas, and the other in South Carolina. I also serve in the supervisory role of 6 nurse practitioners. This was something that was important to me, mainly because I have two main communities that I actually serve personally. One is for a concierge practice, which is dealing with elite athletes, so collegiate, professional, retired, and those who actually are transitioning to retirement, as well as super moms, moms who parent children with ADHD. And the idea behind this was basically I was getting a flooded with questions in regards to COVID-19 and how to safeguard our families. If we have certain chronic conditions, what do we do? If we're exhibiting symptoms, what is the next step? And so thank you so much for joining me. For all the audiences here, we welcome you. And we are going to get right to these questions, but don't forget to share this. Dr. Jarrett says, look at these views, docs. Everybody's been waiting on the brothers. Everybody's in this room tonight, y'all. So let's go ahead and get started. Dr. Brad, first question here. I see lots of patients with varying degrees of knee arthritis, and they're asking, what can I do in the meantime to manage my knee pain, yet remain active at home?
Yeah. So my practice is relatively unique. I'm not nearly on the front lines. We see a lot of joint pain. As a matter of fact, we see a lot of chronic joint pain. What's changed in our practice is we're really not seeing any chronic stuff. As a matter of fact, the Texas Medical Board has pretty much came down and said, look, anything chronic related that is coming to the clinic related to joint pain does not need to be seen right now. So the majority of what we're seeing is what we call hot joints, so joints that are acutely painful or swollen. But that doesn't stop the person who's been having chronic knee pain for a while, who's still having pain out there, whether they were former athletes or whether it's just, Aunt Susie who's trying to, get her walk around the park and she can't do it because her knee's been chronically hurting. So we've been trying to, and the other thing is my practice is one in which I have to touch, I have to examine, telemedicine for me is extremely difficult to try and treat patients with joint pain because I need to see it. I need to feel it. So we've been trying to manage joint pain over the phone, this isn't nearly as acute as, acquiring the virus and so forth, but we've been just trying to manage that, over the phone, people with joint pain and not having them do too much to where, they're getting hurt, but just trying to provide some level of advice. So for most people, what we've been seeing, I see a lot of knee pain, and we've just been advising to make sure that they stay in motion. So particularly knee arthritis does not like impact. So doing a lot of jumping or a bunch of running, but it does like motion. So we're telling people, if you can try to stay active, so to speak, and get on a bike, whether that's a stationary bike or bike outside, depending on the level of restriction and where you live, it might have to be a bike inside. But we want to encourage people to just stay in motion, take advantage of anti-inflammatories if they can, and use things like knee sleeves to be able to help keep the joint warm and stuff like that. Other physical therapy exercises they can do at home. So I'm telling them to go to YouTube and type in physical therapy, straight leg raises and quad sets, different things that they can try to do just to manage this in time so that, once everything, calms down, so to speak, they can go ahead, come to clinic and we can start getting busy on getting their knee back.
Thank you so much for those tips, Dr. Brad. Very,
Yeah.
very useful tips. Dr. Brown, question for you. Yes. So, because of this time, it's very likely that many people are experiencing anxiety and depressive symptoms. What are your suggestions on how to manage these things? Not to where maybe it's not a point of severity where they have actual symptoms and that would lead them to hospitalization, but I'm also considering, those who have pre-existing conditions. How do we get a good hold on managing anxiety and depression?
Yeah, so it's kind of a tricky situation currently. Just simply because of the times dealing with this pandemic and the fact that we can't leave our homes, the fact that when we turn on the TV, all the news stations are every day, the numbers are changing, the amount of deaths and all of those things basically flood you all at once. Our lives are basically changed just like that. So when that happens in this society, we basically have to, first of all, understand we can only control what we can control. So that means controlling what comes into you as far as the information you receive, controlling your environment nearby, and trying to control your day-to-day schedule. So just some simple things that you can do is starting with that, your daily schedule. Trying to the best of your abilities, even if you are single, married, have one kid, two kids, many kids, and you're just at home, trying to adhere to something every day, setting a set schedule that's complete with time for you to work if you're able to work from home. If you're not working from home, having something set up for your kids, or something where you and your significant other can do activities such as board games, such as other type of phone games that are now available for free. There's like online games that you can play. As well as if you're dealing with symptoms of anxiety or depression, specifically feeling deep sadness, feeling like your sleep or your appetite have changed significantly, even to the point where you feel like you're starting to get somatic complaints, sweating, heart racing, palpitations where you feel like your heart's beating out of your chest, things like that. If it gets to the point where it's interfering to your day-to-day, I would worry more. And there are services available, specifically urgent care centers, specifically ER centers that are still available for you to go to if you need to do that emergently. But if it's something that you can handle at home, there's other online resources that you can do. Specifically, there's mindfulness websites. So mindfulness is basically a technique where you can practice relaxation skills, because mindfulness basically is when the mind and body are connected. So when you're relaxing your mind, all these somatic complaints, somatic means body complaints, like the complaints I was just mentioning, they tend to get better. So there's online mindfulness resources that you can use. And I can actually provide some of these resources and provide my contact information. There's also free workouts that you can do. Peloton, Nike, SoulCycle, they all have free at home don't need equipment types of programs that are actually available until April 30th, which is right now the proposed deadline for us staying on this isolation nationwide. There's also spike in substance use. So specifically like marijuana, alcohol, things that people use to treat some of these conditions. So there's national hotlines that are available and resources I can also provide to help with that. The National Alliance of Mental Illness, NAMI, also has a fact sheet that gives other techniques, other resources. So there's a lot of things that if you just Google how to deal with anxiety and depression with COVID, some of these resources do come up, but I can also provide additional resources to kind of help with families and individuals who are dealing with these conditions. But there's also things outside of the home that are still available for those who need a little bit more help.
Outstanding. Thank you so much, Dr. Donald. Really appreciate that advice as well and all those resources you've given. Dr. Nee, we just heard that Dr. Matz mentioned the number of cases at his hospital currently that have patients on vents. Can you tell us, can you give us an explanation of why so many people who are impacted with COVID-19 require ventilation?
Yeah, so basically what's going on is you're getting an infection, or patients are getting an infection of their respiratory tract, but it's more than just an infection. It's actually what's called inflammation. So you get a significant amount of inflammation to your respiratory tract, specifically to keep it as simple as possible, the areas where oxygen and carbon dioxide gets exchanged in the lung, which is something that's called the alveoli. That small little bag where oxygen and carbon dioxide are exchanged, that area suffers a significant amount of inflammation. And when inflammation occurs there, then gases like oxygen and CO2 can't cross over and get into the body the normal way. As a result, patients start to feel short of breath. They may feel like they need a lot more work to get a normal breath in. Ultimately, they may feel like they're drowning, basically. And another term that the audience may hear, or people watching TV may hear, is something that's called adult respiratory distress syndrome, which is basically the same thing. A significant amount of inflammation that occurs to the lung, that normal gas exchange, the ability to breathe doesn't occur normally. And what you need is you need a ventilator to take some of that work off and allow the ventilator to do that normal breathing for you while your lungs heal. And the reason I bring that up first, I'm going to go and pivot into a story about when I do work in Ghana, West Africa, which is a medical mission work. So me and my wife, we go there and we do work. I do general surgery work. My wife does OB work there. And it's a place that doesn't have many resources whatsoever. And oftentimes I'm doing surgery in the middle of the night, or we're doing surgeries and there's no ventilator. An anesthesiologist there is taking care of pain, and there's maybe a tech who's actually bagging the patient while the patient is unconscious while we're getting surgery. And some of the things that you think about is like, wow, like I'm really grateful that I work in the United States and that we have these ventilators, or we have all of these different resources, that we don't have to really be in that type of situation where you actually have to bag a patient while they're undergoing surgery. And lo and behold, years later, we're pretty much, depending on which hospital you're at, we might be at that point where we have such a limited supply of ventilators that some people may need to be bagged individually here in the United States. So ventilators, unfortunately, are very much in short supply. The United States had a plan from, I think, 2007 to 2017, where they tried to make a deal with some companies to get some really cheap ventilators just in case something major like this happened. Back then, they were planning based off of what we saw with MERS, as well as with SARS. So this was like a national pandemic plan. Unfortunately, it didn't plan out the way how it's supposed to plan out. So there's this huge shortage of ventilators. However, there's this huge system, or the system is basically stressed with so many people coming in with respiratory infections and this respiratory inflammation. And that's the basic reason why so many people are being put on ventilators, is the way in which we are reacting to this type of infection.
Wow. Thank you so much, Dr. Nee, and for linking that to your research and your work in Ghana. It's interesting how things work.
Yeah.
And where we're going, right? And so, no, I appreciate that explanation, because being on ventilation sounds scary. And so I'm glad that you were able to, kind of make it portable for people to understand what that means and kind of the direction that we need to consider. Dr. Pierre, what about the pregnant mamas? I'm concerned about my pregnant, friends, and I mean, does this virus impact them? And if so, how so? If you can share your knowledge about this.
Yeah, well, I'm gonna keep it all the way real. Is that we honestly don't know enough yet. I'm constantly checking ACOG, or American College of Obstetrics and Gynecology website, every day to see what the updates and things are. But there's not a lot of information that we have, and that's just because simply there has not been enough time to pass. As we know in medicine, you really can't formulate a bunch of opinions as far as how it's truly impacting people until you have a substantial, size of patients. But the positive thing that I think that I have at least seen is that, in talking to many of my colleagues and from the patients that I've actually personally dealt with, it's not impacting pregnant women any or much more differently than it is the general population. And that is, given the same rule of thumb, whether you have a pregnant patient that may be having having comorbidities such as hypertension, diabetes, or anything else, it's going to impact them much more than a healthy pregnant woman. So what ACOG is recommending is the same thing that as the general population, as far as preventative measures, with social distancing and clean hands and all of those things. And one of the bigger things as far as pregnancy is concerned, and staying healthy, which is a misconception, is exercise and diet, because that's lost a lot. It's a big misconception with women, especially in our community, that you cannot exercise and you can't do the things that you did before pregnancy as you can in pregnancy. And you'll see a lot of women start to decompensate and become in a more, physically depleted state with pregnancy, because there's a lot of misconceptions of things that they can't do, whereas ACOG is strongly recommending even more now than ever, to stay in tip top shape as far as, just working out and eating appropriately. But as far as it impacting pregnant women, I have not seen that, at least not in my hospital, not in my city in Chicago. I have not really heard many cases where women are being impacted heavily during pregnancy, which is actually a little bit surprising, just because of the physiological changes as far as blood and plasma volume and fluid volume during pregnancy. I would have intuitively thought that it would have been much more impactful, but it's not. And as far as the infants are concerned, there's not been any just widespread issues with infants. And I know I have a bunch of neonatology as well as pediatric colleagues that I've spoken to that have taken care of COVID babies, and a lot of them have not even acquired the virus. They've had tested negative even with positive moms, which is also a very encouraging sign nonetheless. But, I don't know what's going on all throughout the country. I do try to stay current and focused and read and see what other people's experiences are. But at least in my circle of colleagues and the things that I've read, there has not been a huge impact. Now that could change again, just depending in what specifically is going on with the obstetric patient. But for healthy women, it's pretty much similar things that's happening as in the general population.
Thank you, Dr. Pear. That's very reassuring news. Thank you so much for providing your knowledge and expertise. Dr. Thomas, question, what is the best way, if I have back and spine pain, what is the best way to manage my back when I can't seek out medical attention because it's not as severe if I were to have, the common symptoms of COVID virus?
Sure, that's a great question. And just like a lot of people here have stated, the challenges right now of accessing healthcare providers, just, Dr. Brad was talking about how, they're not seeing people for, you can't touch them, you can't really examine them, and they're trying to keep risks down for everybody. And so one of the mainstays of treatment for patients with musculoskeletal symptoms as it relates to like the neck and back is to seek out physical therapy or to have injections. And those are two of the mainstays for these kinds of problems. But, physical therapy requires that touch that Dr. Brad mentioned, that people are trying to avoid. And, as far as having a procedure, you put people in harm's way. They don't necessarily need to be in harm's way. And so it's tough. And unfortunately, we're having to rely more on medications to help patients for the serious pain patients. But the most important thing is that you stay active. I've actually been practicing what I've been preaching. I've been riding up and down the bayou with my kids. I bought bikes this week. I feel like I'm like a new adventure kind of outdoorsman right now. And it's really important to stay active. And I think a lot of us could use the physical activity. But if you stay still, your muscles get real tight, and then they tend to be painful when you start moving. And so that's the most important thing, is really stay active. And we've been trying to encourage our patients to stay active. And then for patients who actually need to have something done because of pain that's actually uncontrollable, a lot of people have chronic pain out there, and we take that for granted that, they rely on patients on regular routine medical care. And since they can't get it right now, some of those patients have elected to undergo surgery just to keep them out of the hospital setting. And so we've actually entertained some patients like that, where we've actually we're operating on them a little sooner in the treatment totem pole because we don't have access to like physical therapy or don't have access to pain doctors to do injections and so forth. But staying active is the most important thing you can do.
Awesome. Thank you, Dr. Thomas.
Dr. Don, you mind if I jump in real quick?
Please, yes.
So Dr. Thomas Jones brings up an excellent point. I don't think people understand, for a lot of these folks who are in chronic pain, I mean, we're meeting, me and my partners are meeting constantly to try to figure out, is this somebody who is worth coming to the clinic right now? Because if not, if they continue to have pain and we can't treat that, even though it's chronic, and the medical board is saying it needs to be acute in order to come in, Now we're diving into things about what Dr. Donald Brown just talked about. Somebody who's in chronic pain at home gonna start getting depressed, anxiety, and it's just gonna start spilling over into other stuff. So one of the most difficult things that our practice is trying to figure out right now is who can we see? Like who can come in the clinic? I'm literally texting a friend right now who's saying, "Hey man, my wife's knee is bothering her. Can she come back and see you?" And I'm conforming this long text trying to say, well, it's tricky. It really kind of depends on how bad it's bothering her. And these are decisions that we've never had to make in terms of try to be selective in terms of, well, how much pain are you in? And then now we can see you. And depending if it's bad enough, you have to, say, well, now you got to be at risk of potentially exposing yourself out here. So, the game has changed. For any of you guys who have private practices, or I haven't been in the hospital in a long time, but I have a private practice, anybody who walks in our door gets, they're getting screened. We're taking temperatures on everybody, taking a history. We're in an orthopedic office. We don't ever ask people about cough, colds, but we're asking people. Dr. Thomas Jones laughing, but we're asking people about this stuff now. But it doesn't matter if you just walk in the door; they're getting screened. And it's a surprise for me to see how many people actually have low-grade fevers that we're like, wow, we got to turn you away. You got to go. So it's a constant trying to figure out who do we see, and knowing that there are people who probably need to be seen, because if not, they'll start having to deal with anxiety and things. There's a ripple effect that people don't understand that we're still trying to get our heads around. So
yes, so many points you made in there, Dr. Brad. I guess I want to ask Dr. Will this, and it kind of actually goes with what Dr. Brad is saying, or a little bit off of that. For those who've actually tested positive for COVID, Dr. Will, and they know that, they're just busybodies. They know that if they stay active, they want to go back to work. They need to go back to work, financial reasons to provide for their family, but also for mental reasons, right? If they're just staying at home and they're not able to do what they need to do. What is the expected time frame? Does anyone know when they can go back to work, even if they have an essential job?
Yeah, well, for the CDC has two pathways, recommendations for patients when they're on isolation at home after being diagnosed with COVID. Basically, two pathways are a retest pathway and then a non-test pathway. And usually the retest pathway is recommended for patients that are going to a long-term care, like a nursing home or assisted living, or patients that are severely immunocompromised, or the more severe cases that were hospitalized. So with the testing pathway, it's three criteria. First criteria is you can't have a fever, or requiring medications to keep you from having a fever, like Tylenol. The next pathway, the next criteria is all of your symptoms have improved, like your cough and your shortness of breath. All those have improved. And then the last criteria is for you to get two negative tests that are 24 hours apart. And then the other pathway, the non-testing pathway, which is the one that majority of the population is going to be on, because they're not going to be retesting everybody, is first, you can't have a fever or require medications to stop you from having a fever for 72 hours. So for 3 days, no fever. Symptoms have to improve. And then it has to be 7 days out from when your symptoms initially started. So those are the two pathways, two recommendations. But as always, you need to follow up with your primary doc to get advice as to when is a good time to return to work. And you need to speak with your supervisor at your job. Certain jobs require have different requirements for you to return to work. So certain jobs are going to require you to get retested before you return to work. And then certain jobs won't. So that's kind of on a patient-to-patient basis.
Okay, thanks, Dr. Will. Appreciate all the knowledge you just dropped there. Appreciate that. Dr. Matz, question, what are some of the conflicts of interest for an anesthesiologist during this time?
Well, I always like to, we might be some of the patient's favorite kind of doctors, but, for surgeons and hospital administrators, we're kind of like the stepchildren sometimes, because sometimes we're like the last line of defense, trying to determine whether or not a patient actually needs a surgical operation. And I think the conflicts of interest, particularly during this pandemic, are on a multifold approach. Number one, the American Society of Anesthesiology and the American College of Surgeons, they put out a joint statement when this initially came out, talking about what is considered, an emergent procedure versus an urgent procedure versus an elective procedure. And it was basically broken down into three tiers. Tier one was like your healthy patients. Basically, tier one is like type 1A and type 1B. All your A's are basically your healthy patients, right? So your 1A would be something like a cataract or a carpal tunnel release or an outpatient EGD or colonoscopy. We're basically saying that those are not emergent procedures, so those should not even be considered. So those should automatically be postponed. Then we went to the tier two kind of situations where those are your procedures where like our fellow orthopods on the panel, where you have like your total knees or your total hip replacements. Those are kind of like the tier two. They're healthy or unhealthy, but again, more than likely, unless they're open fractures, those procedures can likely be delayed. And then you get into the tier three category where it's like basically like your intracranial hemorrhages. So like your major neurosurgical procedures, your emergent cancer cases, which even for those, I'll get into that in a second, those aren't really necessarily emergent based off the staging. But also things such as like your limb-threatening procedures, such as like your patients who had poor peripheral vascular disease, who have an ischemic limb, a threatening ischemic limb. Those have to go to the emergency room. Unstable coronary disease that are refractory to dual antiplatelet therapy. Dr. Noble could talk more about that. Like, so those are unstable heart conditions. Those have to go to the emergency. Those have to go to the emergent procedures. But of course, there are a plethora of surgical procedures out there. And so, and just like anything else in medicine, nothing really ever really follows the algorithm appropriately. So we get into these things where, you're talking about, let's say if you have a patient with chronic pain, and then you're wondering whether or not you're going to have to deal with the side effects of, the mental health issues. What's the bigger risk? If a patient, who needs to go for a hip procedure and they have, they're schizophrenic or they have a multitude of other psychiatric disorders. And as you and your physician, if you're dealing with that patient every day and the pain medications aren't working, and then you try to push that to the hospital for hospital administration, or you get it past hospital administration, if the anesthesiologist is not the person taking care of that patient, then you kind of run into that conflict of interest. So it's always like, okay, we try to risk stratify. What are the risks versus the benefits of the procedure? So the risk, of course, as we all know right now, we're in a pandemic, and the majority of our patients are not healthy. They have some sort of medical comorbidity that puts them at a higher risk for prolonged hospitalization or even mortality. And for me, as of right now in Louisiana, I don't know how it is in everybody else's state, but basically for the patients who are testing positive for COVID, we got 4.5% mortality down here. So for medicine, I don't care what field of medicine you're in, that's you're close to high risk. So as always, when you're trying, as an anesthesiologist, you're trying to protect. You're not only a patient advocate, but you're the public safety advocate from that perspective. So that always puts us in line for room for conflict between our surgical colleagues and even potentially administration.
That's all I gotta say, man. This runs deep, y'all.
Yes,
this runs deep, real deep. I'm gonna get through so everyone has a chance to answer some questions. I have one question for all y'all, and anyone can jump in because, man, okay, Dr. Serge. Is it safe to go to the dentist right now? And if I do go to the dentist, like, why should I be going to the dentist? What determines that?
Yeah, your normal just daily or yearly cleanings that can wait, because from the dental point of view, there's basically two ways I look at it. Again, I was in public health, so I've seen, and then I was in public health in an urban area, Harlem Hospital in New York City. So I was there where I've seen in that public health setting where people would rather the type of debilitating tooth pain they had, people who've been shot or stabbed said they had less pain being shot. I mean, obviously it's a low caliber bullet than they did with the tooth pain. So I'm kind of empathetic to that, right? So the thing is, you want to be, show some benefits and help people out. So that's where it pulls at my heartstrings. But we do have a responsibility to do no harm. So that's the biggest thing. So it's definitely shut down, any like elective type of care. So we trying to practice social distancing, right? Because with this information, you guys probably know better than I do. I'm trying to stay up to it because there's always a couple. This thing is highly transmittable. We know there's things that sort of spreadability that one person compared to the influenza A, like you got a flu, influenza, you could affect one person. That's only one person, but this thing has a multiples of 3. So it can affect 3 people, and that's what they're showing in the multiplication. So in our office, what we try to do is still basically do no harm, do social distancing. Same thing like Dr. Brad, Dr. Jones, especially the private practice. We used to screen, right? 2 weeks ago or 3 weeks ago, you were asking, did you go to China? But now that question, it really doesn't matter anymore. Like anybody could have it. So what we try to do, we still take the temperature, make sure 100 degrees. If you hit that marker, you're out. We test, everybody gets tested, my staff. We had to cut the staff down. We try to have no more than 5 people. We try to have one patient, even we tell them not to come in with anybody. So that's really what's going on with that. So, but you have pain, we understand. Because what we do know is like every 14 seconds in the US, somebody goes to the emergency room for the hospital emergency room for dental pain. Again, if you guys having problems, you're hearing all these stories about PPE accessibility. We don't want these fine doctors or physicians and nurses to be using PPE on dental care. From personal experience, when I was like in college, I know when I broke my tooth, I went to the emergency room. My mom was like, oh my God, you're gonna get an infection, go to the emergency room. And we're not talking about we're in a pandemic, and in the emergency room, there's nothing they can do for you. They can triage you, give you some ibuprofen until you go to the dentist's office. So again, give you access. We don't want to waste you guys' time with that. There's about 2.2 million visits in the emergency room. So again, with all this going on, you don't need somebody coming who has dental pain. You're not going to have much to do. You don't want to waste masks. You're going to be safe, N95 masks, all the PPE gear. You don't want that to happen. I mean, for the people at home, well, we try to take all the precautions, even with that. Anything that has some type of like 5% peroxide. So just a quick tidbit, we have people rinse with basically, we have to rinse with like a 1.5% peroxide for 60 seconds. But at home, you can either use like Colgate Peroxil or the Listerine white mouthwash that has 1.5% to rinse down. That could decrease the aerosols with that. But I mean, if you need like a root canal, you need an extraction, obviously there's no place to go but the dental office. But again, we just try to make sure there's not more than one patient. Only we tell them not to come with anybody because they'll be waiting in the car anyway. Wipe down, disinfect as much as possible. We use high-speed suction, right? High-speed suctions to decrease the aerosols. And every week, like I went from, if you look on the ADA or the CDC, they were saying level 3 masks, okay, but every couple of days, I changed my protocol for my staff. Now everybody gets N95 and the level 3 on top of that, because we don't know how long it stays. Again, you don't know if it's an aerosol affected when they talk about people sneeze and the droplets stay in the air for 3 hours, or is it just the droplets, just the pure cough and immediacy, no matter how much you wipe. So the information changes all the time. Again, just in mid-March, we know it was basically multiples of 3 as far as infection rate. Now I know we don't know how long intervals between symptoms are showing. So the best thing anybody can do is basically, especially from outside of a hospital, is the quarantine, right? Because that's the best thing anybody can do. So that's what we try to practice. But if you you can go to your local dentist. Sometimes just medications, teledentistry is probably you guys probably had it in medicine this whole time, but teledentistry is blowing up right now. Again, so people could ask questions or whatever vehicle that you use, whether it's Zoom, Microsoft came out with Teams. So everything in medicine is probably going to change due to this. You're not going to practice the same anyway.
Right.
Like Dr. Brad and Dr. Jones were like, we in Texas. Governor came down, he didn't give no specificities. He just dropped the hammer like, so you leave it to your own judgment. So I leave it to my own judgment. My thing is, the really biggest thing, we always use universal precautions, but the thing I'm concerned, I can't get tested, right? So I don't know if I'm symptomatic or have something to pass. So that's why we do all these things too. I don't want to do harm to a patient as well. So that's until we can get all rapid testing, everybody can get testing, it's always going to be like this I can see this for a while.
Wow.
Can I say something? Like I think it's, and this is just a little bit off topic, but I think a lot of these, famous people and entertainers and stuff, they're going to cause a true uproar and commotion. Like they getting on these social media platforms just saying like, I got tested and got my results back in a few hours or whatever. Like, I don't know about y'all, but like, it's as a physician, I got to pull, I haven't gotten tested, but we'd all have to pull some strings if we want to get tested. They are being very stringent, as they should be, with the resources as far as getting tested. So like, you're not coming off the street as just a Joe Schmo getting tested, and like they're giving these false perceptions that this is how it is. And if you got a call for you feel like you need to be tested, you could just go to your hospital and get tested. And it's not like that, so, something needs to be said with, some of these celebrities that are getting positive test results and how they're spreading that information as far as like getting tested and stuff, because it's not like that.
Right about that, Dr. Pierre.
Really, the private thing is you really don't want it to be like that. When I say that, I mean this. We really want people staying home. Like that's the biggest thing. We're not going to get past this if people are just, even if you think, okay, let me just run into the hospital and get tested. You understand you've increased your risk of contracting it just by trying to show up. You got places like New York City and even places in New Orleans where people are lined up outside the emergency room waiting to get tested. They don't realize that's not practicing social distancing, right? So, I mean, this is way beyond anything that we've ever seen before. But the real reason why we're even in this position right now as a country is because we need our hospitals right now, and our hospitals cannot withstand calamity, right? They cannot withstand, like my hospital, we got 40 patients on the vent right now. That's just COVID positive patients. That has nothing to do with the patients, who have heart failure or other pre-existing conditions that require the ventilators. So that's why it's so important right now for people to stay home, because there's not much people can do to help you if you come to the hospital and you're exposing yourself and you're increasing your risk for not only contracting the virus, but of course spreading it to your loved ones as well.
So I have a question then, because for Dr. Stephen, like what if I'm caught in the middle of this? If I have lung cancer and I need to have surgery, and in the midst of this, is that considered emergent? I mean, I have lung cancer. I already had my date before COVID came. What do I do?
That's a great question, Don. Prior to the American College of Surgeons, came out with their recommendation, I had a stage 1A lung cancer patient that had cancer. And so in looking at the data that we were seeing out of China, as well as Singapore and these other places, I talked to the patient and discussed my concerns. First and foremost, if I'm going to remove part of your lung, you are going to have a decreased lung function after the surgery. What we're seeing with the COVID-19 data is that even if you recover from COVID-19, you may have a 20 to 30% decrease in your lung function. So if I take out part of your lung, and then she's over 60 years old. So if she contracts COVID and she survives, she's at a higher risk of having some major problems. So I think for that, we had a discussion and we had two options: either wait 6 months or 3 to 6 months, or go with another alternative form of treatment, SBRT or radiation therapy. For her, she decided to do radiation therapy because even with her lung function, she was marginal. I think as what I tell all my patients and what I really tell everybody, mask up. Everybody needs to mask up, regardless of what the CDC says, what the WHO says. We all need to mask up. If we take a look at what we see in China, Singapore, and all these other countries, the bare minimum we can do is mask up. Dr. Serge mentioned it earlier. We don't know if you're contagious, but what does the CDC recommend for those individuals that are contagious? If you are COVID positive, wear a mask. If Dr. Sanjay Gupta is on TV saying we need to act like everyone's COVID positive, that means everyone needs to walk around in a mask. Now, we have a supply chain issue in which we don't have enough masks. However, the CDC told healthcare providers, if you guys run out of masks that you're using for a week on end, wear a bandana. So the point is that you can cover your cough, your sneeze, and whatever, your respiratory secretions by wearing a mask. I'm very concerned about Dr. Max's patients because he has 40 patients in the ICU that are intubated. With the data that we have about intubated patients with COVID-19, 35% of those, we have a 35% success rate, meaning out of those 40 patients, 14 will survive. So the key is not to get it. Staying at home, as easy as it sounds, is a luxury for those that are affluent and privileged. That means you can sit up here and don't have to go out and get groceries. You don't have to go out and worry about putting food on the table, or that you are in a place in which if someone in the house quarantines, you can be separated. It's very hard for our community in particular to sit up here and shelter in place. And one of the reasons why we see the South, that I fear that the South is going to have some major problems, is because we have a higher rates of health disparities, of high blood pressure and diabetes, and COVID-19 is going to come down that like a storm like no other. The last time we've seen something like this was in 1918. And in 1918, in the Spanish flu, we lost 675,000 Americans. We all need to mask up. And I fear that we are headed towards a Great Depression, given what the Fed said can be a depression rate, unemployment rate as high as 32%. The Great Depression, we had an unemployment rate of 24.9%. The least we can do is mask up.
Wow. Dr. Eddie, so given what Dr. Stephen just said, which, I mean, what drives you every day to go to your clinic and treat your patients, yet you're placing yourself and your family at risk? Like, how are you able to do that being a physician? Because it's a conflict, right?
Yeah, it really is. And that's a great question. But in the end, I feel this is a calling. This is what, I was put here to do. I took an oath when I signed up to do this. And so that's what I'm going to do. My hat goes off to Max and others on the front line. I'm trying different things in my clinic to try to limit the amount of traffic through the clinic as much as possible. But, patients still want to show up. I've had patients say, hey, I've been waiting 2 months for this appointment. I'm still going to come. So we've been trying to practice more things such as telemedicine, telehealth, but we still have to take care of patients. I have chronic dementia patients with Alzheimer's disease that live in nursing homes, and their nursing homes tell them, if you go to Houston and see Dr. Patton, you can't come back for 14 days. So then what do we do at that point? Because their family is still calling, that the patient still needs to be treated. So this is going to change, fundamentally change healthcare as a whole moving forward. And we have to make certain adjustments. It's going to be uncomfortable because social distancing is such a hard concept for most people to take in. As a neurologist, I depend on my examination. I still have to, I have to come within six feet to examine patients, and I still see new patients in clinics. So I know every time that I examine a patient that I'm putting myself at risk and I'm putting my family at risk. But we do try to screen and take all those precautions ahead of time. But that in itself is not enough. And even from a state level in Texas, they're restricting travel from certain high impacted areas. But patients lie; they won't say they travel. They won't say they're from here. So as you go in, you put yourself at risk. But I just say a prayer and know that this is what I was put here to do, and we still have to do that to take care of patients.
Amen. Dr. Berry, how about for those patients who are, like, let's say I'm a family member and I can't visit my loved one. I'm hearing OBGYNs tell me that, their fathers can't be there to see their child delivered. Some patients have COVID-19 positive, right? Maybe intubated, but they're all alone in the ICU. What do you recommend as far as being a family member? How can I communicate with my loved one if I can't physically be there with them?
And I think that's probably one of the most important aspects that obviously the person who has COVID-19, right, they're affected, right? We know that for sure. But it's the family members, right, who a lot of times we don't necessarily think about, especially as a hospice physician. And I'm just seeing patients, day on day in, room to room. And it was, I didn't even realize that they had kind of restricted, people to come to the hospital. Like it just like on a Monday, they're like, all right, no more visitors completely. And it's very difficult. Imagine your family member goes into the hospital, right? Like, again, you hear these rates, right? Again, if they end up intubated, right? It's a good chance they're not coming out the hospital. Imagine sending your loved one to the hospital and never even being given that chance, right? To talk to them, to look at them. And the only call you get, right, is your family member did not make it, right? You want to talk about anxiety. You want to talk about stress, right? Like and that's really the issue, especially, a lot of us here are really trying to champion, like, it's not only you who are affected, right? If you get COVID-19, right? It's everyone around you, everyone who's in your atmosphere, right? Who's connected to you that gets affected, right? When you aren't, practicing what you need to practice, right? Staying away, all the best practices that you need to. And I know as a hospice, I made it a point now to call every single family member every single day. And that's not something, again, that's a change in me, because that's not something I was used to doing. One, because family members were usually right at bedside. But now that I know that, like, they don't know what mom is doing, they don't know what dad's doing, brother, sister, and all they know is that they're just, they're calling nurses left and right. They want to hear from us, right? They want to hear from the people who are taking care of their loved ones and given that chance, right? Again, I've had the FaceTime, right? I've FaceTime a family member just so they can see, right? Because again, imagine, again, not only can you not talk, you can't touch, you can't see. And that's a very tough position to be in, not only for your patient, but also the family member as well. So as a physician, especially as a hospital physician, understanding that communication is much more of an important factor than ever, right? Because if your patient is stressed, if your patient is anxious, right, they're not going to get better, and the family members definitely is not going to happen, right? So we really, again, a lot of things are changing, with the pandemic that we're experiencing, and I think just a level of communication as a hospice, and I preach this to my residents as well. You better be reaching out to family members like every day. Like it's not even an option anymore. Like, oh, I'll just call them tomorrow, because they may not have tomorrow, right? I was out last week in the hospital, and I left before I left the hospital, we had, let's say, I would say 10 to 15 patients, like in the whole hospital that we were concerned about having COVID-19. When I came back, I myself was looking after 10, 15 patients, right? Just by myself. A whole floor has been taken away. ICU rooms are being moved. So this is definitely a disease that is extremely, extremely going to cause some damage and concern, and you have to reach out to the family members. You have to keep them abreast, because if they're, especially if you love your nurses, right? Because if they're not calling you, they're calling the nurses every hour, right? So like, please definitely make sure you're reaching out to family members on a daily basis, to keep there, especially when it's not looking good, right? Especially when you're one of the 40 members on getting intubated, right? And now you can't talk anymore, and the likelihood that you're going to talk is very slim.
Yes. Dr. Bryant, can you add to this? I know that many of the gentlemen on the panel actually discussed if they are essential workers, which all of you are. But if there are any ones that's listening right now in our community, what if they basically, how can they stay healthy? How can they remain healthy? How can they prevent from having the illness if they can't stay at home, but they still have to go to work? Is there anything else that you can add to how they can maintain healthy states?
Yeah, that's a good question. Because there are a lot of us, outside of healthcare, right, that are considered essential workers. You think about all your first responders, police officers, EMS, even gas station attendants, and all those folks that kind of have to keep the physical infrastructure of major cities and countrysides of America running. So, first and foremost, the social distancing thing is important. And it's, I would say, make sure if you can to keep as much, distance, that 6 foot distance apart from other people if possible. The reason that social distancing has become a thing is that the CDC and articles that have been released on COVID-19 and other coronaviruses, it's suspected that the spread is related to droplets. So if someone sneezes or coughs, that those little droplets are aerosolized into the air, and they can travel, some distance, but that 6-foot space between you and the next person may be enough to, minimize your risk of catching something from someone else. So social distancing is one thing that, if you can do it, do it. Second, of course, for those that work at places where they physically have to go and, do things and touch things, make sure to disinfect your surfaces, because, we all like to think that, our, as a hospitalist, we have this community office where, it's, 8, 9, 10 doctors all in one room. And, yes, I use the computer on the far left 90% of the time, but when I'm not there, somebody, may have come in and touched it. Maybe the housekeeping staff came in and touched it. So making sure that you disinfect your surfaces frequently, especially those things that you touch on a regular basis that are, communal properties at your home, at your business. Those doorknobs, they get touched by everybody. So having someone to be responsible for making sure you disinfect those things that you touch often. Of course, the other thing is they say, try not to touch your face as often as we sometimes do. And it is a habit that I am guilty of. I mean, periodically, I feel a scratch on my beard, or, I might rub my nose. It's allergy season, I might rub my eye. And, if I'm not disinfecting my hands frequently, that can become a significant issue. Which brings me to, the last point is, for us, I mean, these guys probably wash their hands more than anybody in America. I can't count how many times, you walk out of a room, you hit that hand sanitizer, and you do this, and then you're on to the next room. So, you wash your hands or disinfect your hands very frequently as physicians and caregivers. But for the general public, that's something that you want to do as well. So increase, your hand hygiene from washing your hands more frequently. And if you can't wash your hands, then utilizing an alcohol-based sanitizer to do so. The other thing along with the hand hygiene is to stop shaking hands right now. So right now we're doing the elbow bump, with folks. We're doing the nod. We may give the peace sign and kind of keep it moving to acknowledge other people that are in your community. And those are things you can do to try to keep yourself safe. Especially for those of us that still have to go and interact with the environment and community.
Yes.
Can I say something real quick to that? I'm sorry, can I just say something to Dr. Pryor? You mentioned a very good point. I want to emphasize again the importance of washing your hands. The key to not spreading this disease, you've heard it over and over, along with distances, is taking personal responsibility for this. Brothers, we've all seen or been in the restroom when we do cut the water on, run it up under and shake off, and that's it. Wash your hands 20 seconds, saying happy birthday. If you don't know how to wash your hands appropriately, there are plenty of videos. The CDC website, other places has videos that will show you, but 20 seconds of thoroughly washing your hands as much as you can throughout the day before you touch your face and so forth. Highly important. Just wanted to stress that.
Yes, definitely. Thank you for making that stressful point, Dr. excuse me, Eddie. Y'all, listen, talking about the African-American community, there are certain people in our African-American community that are building blocks for our community. I'm talking about the barbers, the beauticians, the nails, salons, all of these individuals and entities that help with our beautification, right? Our grooming. I'm concerned. And I know Dr. Noble and I have talked about this, and some other doctors. Does anyone have a proposal and how we can bring forth, their story, how we can help serve them, because they're out of business. And so we need to really support the building blocks that serves our community well. Any ideas?
House calls, maybe.
See, but see, once again, I think we have to be really careful about that too, right? Because even when you talk about, people such as our barbers and our beauticians, the thing is, they even if, let's say, if they're making a house call and you go into someone's home and they haven't cleaned their surfaces, and then you're touching them on their skin, they're touching them on their hair, and they haven't washed their face or washed their hands. And let's say if they got some bad kids or they're taking care of an elderly, family member, so they can contract that, and then they're going from home to home. And this disease is so highly transmissible, it's unlike anything we've ever seen. So I know it's a tough, position to be in, but hey, I'd rather look rough for a couple of weeks than potentially lose my life because we're not following the proper social distancing guidelines.
Definitely.
Well, unfortunately,
I think about it. I think about when guys go to the barber shop, and it's like therapy session for y'all. When we go to a hairstylist, that's our therapist. I'm concerned for them. How can we help them?
in Chicago, they you can't stop these cats from doing it. Like they charge a premium and people going to their houses. Like I see it all the time. Like I had I had somebody from Xavier reach out to me today because he was salty because his barber just used it opportunistically to just hijack the prices on him. He was like, I'm a loyal customer. I was just like, man, I feel you, but man, these dudes, it's gonna happen. I see, because I know at least because I'm a barber myself, so I know a lot of barbers that are out here, and they'll have it, and they'll just like on the black market to just have like guys one by one coming in there. I'm not condoning it, but it's hard because it's like, man, people still got to pay bills. People still got to feed their families. These bills not gonna stop. You got large corporations like Chase and Bank of America that are looking out doing their parts, but these small banks are relentless. They don't care. They still want they cut they cash they payments. And so it's hard to tell somebody like, cut off everything. And you got people really that got to eat out here and have incomes, so it's tough.
As a Don, this as a small business owner, I'm a owner of a barbershop. So having barbers as employees, and staff, and ultimately for those that have been with us long enough, they become family friends. And we closed our doors because of this, and what we have done to try to answer that question for the barbers as to well, what are you going to do? Their bills are still coming. We have reached out to the barbershop customers in the community that that we serve, and ask the community to help us if they can. And we've had an outpouring of a lot of customers and clients that said, what, hey, I'm well off enough that I would want to contribute to a GoFundMe or something to help those guys maintain during this time when they really cannot serve in a high touch industry like barbershops and salons.
So I'd like to add that I personally believe that with certain conditions, barbershops and hair salons can be opened. I think that first and foremost, the barbershop and hair salons are an institution that is the backbone of the Black community. Second, it's an institution that historically has survived recessions and depression. In 1939, during the Great Depression, the hair care industry made $6 million. So historically speaking, this is an industry that can survive. However, the traditional model of the barbershop would have to change. The traditional model of the hair salon would have to change. And I think we need to get back to the roots of the barbershop. The barbershop was the first delivery of healthcare in our communities. The reason why the barbershop is red, white, and blue: red is for the arterial blood, blue is for the venous blood, white is for the bandage, and the staff is the stick that these gentlemen grabbed onto as the barber or the surgeon was making an incision. So we need to get back to the roots of the barbershop, and how we do that is employing social distancing principles. Try to make sure that you space your chairs out 6 feet. But first and foremost, it starts with the scheduling. You can no longer have a barbershop in which you have several patrons waiting. So if a barber goes to a barbershop app in which they schedule their appointment, before they walk into the appointment, just like Dr. Brad talked about how he has to go into his clinic, and before he walks into that clinic, he gets a infrared thermometer scan, and if it's green, he's allowed to go in. If it's yellow or orange or red, he may have to answer some more screening questions and potentially do a point of care test that Abbott is just came out with. Now, if we have doctors that are connected to a barbershop through telemedicine, those doctors may be able to order that test, and those doctors may be able to charge for that telemedicine visit and order that Abbott test to sit up here and say, you know what, my patient through the barbershop is COVID or has a temperature. Why don't we order the Abbott test? If that test is positive within 5 to 15 minutes, we can isolate, because we need to know where these patients are so we can quickly isolate them out of the system. The barbers themselves should be in PPE or a mask, or they should be on a PAPR if they have a beard. This is what's being done in other countries. China employs some of these techniques. At least all the barbers and the patients are in masks. This is what was done in 1918 during the Spanish flu. All the barbers were in masks, and sometimes they did haircuts outside. But Dr. Pierre and Dr. Max bring up great points. The barbers are gonna go to houses and cut hair. My wife's a hairstylist, and she knows stylists that will take home appointments. And great points were mentioned as far as why that is a dangerous proposition. So if we can control it with conditions, I think we may have something.
Woo! So we need to change the narrative. Isn't that something that Dr. Johnson, Dr. Max often talk about, is changing the narrative? Why aren't any of you running for office? Please answer that for me. I will vote. I will support you. I will fly wherever you need me to be. I will be there. Do you hear me?
Can I say something, actually?
I support Eddie Patton.
Can I say something, actually? Can
Please,
I say something?
Yes. This is free flowing, y'all. We're not formal. Please talk.
And this goes with my podcasting background, where I like to just push the conversations and have more controversial conversations. I really feel like this is an opportunity where we as physicians really, when you're talking about the narrative, this is an amazing opportunity, particularly as African-American physicians, knowing how the healthcare system has so many disparities that affect people who look just like us. This is an opportunity to really put a magnifying glass on something like this and shows that basically our healthcare system is like a house of cards, right? Someone at first mentioned that people who have money can get a test, whereas majority of people who don't have money can't get that test. There's something wrong with that, right? Because the way in which you should really manage, or the way in which you should really evaluate a healthcare system, is how it really takes care of people who need healthcare the most, or people who don't have enough money to pay for certain things, right? The people who need it the most is really how you make your basis of if a healthcare system is good or not. And I think we all can say that the healthcare system is showing so many holes. This is an opportunity for us to all get together and just create some type of narrative where we are driving it, not just treating people, because there's more than just treating people, right? Like we've done that enough, where we've treated people and we have allowed other people to really speak our voice or talk on behalf of us or make laws on behalf of us without us really inputting things, because we say that we just want to niche ourselves into the hospital. There's an opportunity for us to get out there and start talking to our lawmakers, or just us in general, come together and, create some type of consensus statement and say, look, like this system ain't working. Like it doesn't work for us. It doesn't work for people who really need it. And, we need to do something about it ASAP. So I just wanted to put that out there so people can even talk about that, so that the audience can know that doctors see that this is going on. It shouldn't just work for the rich and wealthy or affluent. It really should work for people who need it the most. If you've seen what things are going on in Louisiana, or if you've seen what's going on in Queens, and Queens is not too far from Manhattan, right? And Queens, like, you're having these death rates that are just ridiculous. So these are just things that I think we should be talking about also. And I hope, we can, really, get some type of something that we can really, provide to somebody as some type of white paper or something from this.
Can I say something real quick? Dr. Nee brings up a great point. When the dust settles, we got a lot of stuff to look at, particularly in healthcare, outside of healthcare. This thing is going to bring the magnifying glass on everything, everybody. Dr. Stephen Noble brought up a point too. In essence, we're going to have to adapt and change so many different industries as a result of this. But right now, the cure, so to speak, which is social distancing and doing, all these extreme measures to try and prevent the spread of it, is coming at a great cost in and of itself. So I look at this thing almost like a chemotherapy in that, yeah, sure, it might be treating what's happening, but boy, it's sure coming at a great cost that it's causing so much, economic havoc that at some point very soon we're going to have to try to figure out how to open businesses despite what's happening. Because to shut down until April 30th, I mean, people, I just they're going to be thinking about survival mode. I mean, so we at some point soon, it's going to have to be some way to adapt businesses with wearing bandanas, wearing masks, something so that the barbershops can be open, so that something has to be open in order for people to start generating money to start to pay for stuff. Because if we can't have consumers, and I know we're getting outside of medicine right now, but at the end of the day, it's still a part of it. If we don't start having consumers in the economy right now, this is going to be, we're talking about the chemotherapy treatment of the whole COVID right now. It's coming at a significant cost.
Yes, it is. And doctors, I know it's an hour and 30 minutes into the broadcast. I can be here all night and I will be. I'm just letting you know. I know that some of you have not been at home for days. Some of you have not been at home for hours. I know that this is your family time. So we want to respect that. We have to have another session. It has to be multiple. Whatever I can do to support all of you. I think we've birthed something here tonight. I know we did. And so I'm going to continue the conversation as long as you do, but I just want our audience to know if someone has to step out of the room, we definitely understand it. We applaud you. We love you. We're praying for you and with you, and we will definitely be back to continue the discussions because you all have a lot of questions and a lot of support and love in the comment room as well. So I'll let you all have it, but if someone needs to leave, we definitely understand.
Hey, Dawn, I actually had a question because I'm in the same boat with Dr. Brad and probably Dr. Jones and Dr. Patton or whoever has a private practice. So, you can have a whole different discussion on the financial impact, but the seriousness of the social distancing, because I just read an article, and this is actually a question for all of you guys that work in the hospital. I wonder if hospitals are even talking about this right now, because I just read an article talking about we social distancing right now, and the hospitals are taking all the patients who have the symptoms or who are really sick, right? But the way Wuhan or China was able to really stop it, they were saying they weren't sending the mild patients back home, because the mild patient, we could say within the house. And again, if you have that privilege to live in a house, right? I'm from New York. I know in New York, they put apartments, they put up walls. You could have 7 people in an apartment, but the mild symptom cases are going back, still infecting other people. So I don't know if hospitals are talking about, we need to create, whether using stadiums or creating a space for quarantining the mild symptoms, because in Italy, they said that's when Italy got hit hard, when they kept on sending those people back, and then they were infecting a family member, a couple of family members. So I don't know if that in the US or the hospitals are even talking about that yet. Anybody could take it, but that's a question I'm kind of interested in.
Sure, Dr. Serge. I can tell you from as a typical hospitalist, right? Most people don't know, right? One of the things we typically get measured is how quickly can I get a patient in, and how quickly can I get a patient out, right? Like that's a big measurement for us, right? Like a dollar measurement. Like if you get patients out quick enough, you make the hospital money, they reward you. I can tell you this is definitely loosened those restrictions as well. Versus when I used to have administration like, hey, it's 12 o'clock, this patient not out yet. Hey, like when is this patient leaving? We don't even have those type of meetings anymore, right? Like the hospitals have gotten very relaxed at the ability to want to get a patient out the hospital. One, they've kind of been forced to, right? Like we kind of mentioned before, you have nursing homes, rehab facilities saying, we're not taking that patient, right? Unless this test is negative, right? Even if I come in with a broken toe, right? And I need to go to rehab. No, you need to go, I want that test first, because I don't even want the asymptomatic patient to come in, right? So we're seeing an extended, and again, this is really where the problem starting to lie, is our hospitals don't have that capacity to keep people in the hospital, unfortunately, right? So I want to keep every single person here, and you just stay here for 2 weeks. I can't, right? Because I'm gonna have 2 or 3 or maybe 5 people come in the next hour, right, who I have to rule out who may have this disease, and you're taking a bet, right? So we're kind of putting that one eye and saying like, yeah, we want you to practice social distancing, but you can't do it here, unfortunately, because we know that from a spacing standpoint, we couldn't do it if we wanted to.
And that's kind of the disappointing thing about the United States and the experience here, because we're not looking at what other countries have done. China has instituted quarantine centers. So all these hotels in Vegas, in New York, all these hotels that are shut down because of, COVID, they should be repurposed for quarantine centers, both for the patients as well as the healthcare providers that have to sit up here and work. Because you have healthcare providers that are sitting up here, sitting out tents outside because they don't want to get their own family members infected. So what China has done was set up quarantine centers. With that 5-minute or 15-minute test, you can test every physician as they go into that hotel and have them decontaminate. And when they get ready to leave that week-long period of working in the hospital, you test them before they go home. Because what we as providers want to know is we want to know that we're not taking this home, that we are allowing our families to be safe, but yet still doing the things that Dr. Patton talked about, doing our calling. So we need to think outside the box. And all these hotels and rundown buildings that are within our communities, they need to be repurposed for quarantine centers.
They should start with Trump Towers.
Exactly.
So yeah, it's crazy. Like just my whole thing about it is it's like, the priorities of our country have been really exposed with this, because like, the country has put physicians just under the thumb. We can't form unions. We can't really complain about stuff. We really have to give what insurance companies take what insurance companies give us, take what the country gives us. Like, the country will spend freely on whatever they want, from entertainment to whatever, spend money. But then, you got people who spending half of their lives and risking their lives to help other people. You want to give them pennies on a dollar. And now, they're asking us and pushing us to, do the good thing, do the patriotic thing, like help or what have you, but you never look out for us any other time. And now it shows that how valuable we are, because if we stayed at home, then what would happen to everybody? So, if anything, from this whole thing, like, I've been saying this for years, but even more so now, if we as, physicians and healthcare workers, well, more so physicians, don't get a more unified voice for better treatment, and to have a bigger voice of how we treat patients, how, to the things that are going to make us comfortable, and the sacrifices that, the country needs to make for us. Like, we're fools. Like this shows it. Like I got an email where now, like, the hospitals, like all of the hospitals in Chicago are getting packed. So now they are clearing out McCormick Center, which is like a convention center in Chicago, and making that like a 500-bed facility. And then they're saying like, okay, well, yeah, we need all hands on deck, and physicians like in here taking care of these patients. And it's not about the money or nothing. I get it, but like they like pretty much go in there and volunteer your time to go do that.
And you in New York City too.
He was like, it's like, I know people, but I got family to feed, I got, it's student loans and everything else to deal with. Like, when you outside of this crisis, you never looking for us. Like, you trying to hit us for everything, and taxes and giving tickets and parking tickets and everything else. But now when it comes to this, now please come help us. So I'm like, yo, we need to have a more unified voice. And I get it that a majority of physicians, like all around, come from privilege. It's not many of us that are coming from underprivileged, backgrounds. But, with that being said, I don't care what background you came from. You gotta, be valued for what you do, and the, commitment and the time commitment and the effort, the time away from your family, the risk you put into your family. Like, that stuff has to be valued and put on a higher pedestal than what it is now. And if COVID hasn't done anything else, it needs to do that for the country, in my viewpoint.
I'm sorry. I can just let you all just talk forever. I really can, but we want to be respectful of your time. there's so many emotions I have right now, for our country, for our people, for our world, for you all, seeing you all here as a collective, just bringing church to the forefront, and just being a voice for our people. Thank you so much to every single last one of you. I mean what I said. I'm praying to God, and I know. Let me just put it this way: this vision is not mine. This was God's vision. And this something has definitely been birthed here tonight. We need to definitely be innovative. We need to be intelligent. We need to be smart about this. We need to definitely make moves. We all are in our prospective fields, and we know how important it is to be about it versus just talking about it. And I know that we all are about it, in our different communities. So I'm proposing that we come together again. I want to back you all up, and however means necessary. Whoever's that going to be the organizer of this, whatever plans you have, that you want to go forward, but we definitely need to act on this. And I do believe that we have the leaders right here in this virtual room. I'm just saying.
I'll say this as my, I don't know if anybody got closing comments or whatever case may be. Right now, a lot of what I hear is this big question mark. It's one big question mark. We don't know how to manage it. We don't know what's going to happen tomorrow. This is literally day to day. And that big question mark, man, there's one thing, and as a man of faith, all I can say, man, is one thing we need to do is to get on our knees every day. That's just being very real, because most of us who are on here are getting affected too, in more ways, whether we're on the front lines because we're getting exposed to it, or because we got private practices and we ain't practicing. So this is a massive question mark that I don't think anybody has seen. And I'm sure I'll probably speak for a couple other brothers on here, man. It's just, we just got to pray.
Anyone else? Closing remarks?
Yeah, I've kind of talked about this before we kind of came on live. And I think one of the biggest things that this has really shown, especially here as a country, and again, I'm biased, right? I have a master's in public health, right? And one of the reasons why I thought this would get as bad as it did is that not only do we not, cherish, our physician workforce, right? But the public health aspect of our healthcare is so poorly looked at, so poorly represented, right? Like that certain things that we should be able to enact, we couldn't enact, right? So I am definitely excited. Again, like I said, I'm just proud to be a part of this panel. And again, I'm ready to work like tomorrow, right? Like whenever, I see people who want to, enact the type of change that really is going to need to be done. Like I said, we're at the end of March, right? We're going to be talking about this in August, September. Like this is not something, and I really try to stress this to my patients and my friends and family. This is not something that's going away next month. Like I don't care what that whole 30-day to April, that's not, y'all can forget that date. We're shooting past that date as well too. And that's just because unfortunately, the way the United States really cherishes healthcare, public health. So I am ready to work and, ready to get started on whatever I can do.
Yeah,
Don,
just say one thing. Oh,
go ahead, sir.
Thanks, Eddie. So I kind of want to piggyback what Brad was saying. Is praying, but there's one thing I learned because when I was younger, I was a big worry ward, right? Throw pity parties, all that. But as I've gotten older, what I learned is the worry that's going to kill you, right? You don't know what's going to happen, but it does give an opportunity. Even just being on this panel, listening to you guys speak, I feel like a 5% smarter. But it's just knowing that you have to know how to pivot, right? There's always going to be problems. There's always going to be obstacles. Whether you play ball, you just got to get to the basket. Just like, God rest his soul, like Kobe. He was my third favorite player, but he was going to get that bucket. So by any means necessary, you got to roll with the punches. Like I said, a lot of private practice owners on here. Like, again, we dealing with disease, but as from the business standpoint, you might be having to let go of some staff. We have businesses, how we going to pay bills. People still want their rent, taxes, all that. But you can't worry about it, right? You just find a way, you pivot, you make any moves and 3 months, 4 months, 6 months from now, you just do whatever to survive. And then really it's coming as a collective. I mean, just Dawn, thank you for bringing all these people together. Probably just get some information, but using each other as a support. But for the audience, don't let the worry kill you, because that's what affects like heart disease, heart attacks. That's what affects mental illness. I mean, just stay prayerful, stay faithful, keep on going. And then, when you come up with don't think about the problem, just come up with solutions. Come up with solutions that's going to help you, give you better mental health in that aspect. And that's my 2 cents.
Yeah. Yeah, and I'll just like to close by saying, Serge, I appreciate that. And, there is a high deal of power in this group. And, the change comes from us. I think it's fitting that this was done on Doctor's Day. I appreciate everybody as a part of this group. I appreciate every nurse that's taking care of patients on the front line. I appreciate every custodian that's cleaning rooms in the hospitals and in clinics. I appreciate every front office staff that's coming in contact. The point is that this is a team. This is a team effort in healthcare, but it's upon us as physicians to really take a stance and put out the right information. People are getting so much information, misinformation from TV and politicians and everyone else. So when I I feel empowered by being a part of a team like this. So because we have the power to get out there and help people hopefully turn this tide. So, let's stay prayed up and get to work.
Excellent words. I just wanted to end my comments with thank you, Dawn. You're such an inspiration and such a mentor to me. And one of the reasons I became a doctor is because of the shining example that you set for me. So I just wanted to thank you for just allowing this opportunity and me being a part of it. And thank you. I wouldn't be doing my duty if I weren't advocating for my patients. And I want just everyone who's watching this video, who's part of this panel, to just remember those who are incarcerated, those who are homeless, those who are in long-term inpatient facilities that don't have the luxury of isolating in their home. Remember and use these practices that we talked about for them, whether that be the deputies, the nursing staff, the janitors, everyone else. You're coming into contact with these individuals who are in close quarters, who don't have the luxury of leaving. And so we need to do these things in order to save them. And I wouldn't be doing my duty if I didn't advocate for them. So keep them in mind and people in similar situations.
For my closing remarks, I of course want to say thank you, Dawn. I want to piggyback on something that Dr. Barry Pierre, and Dr. Noble both spoke on. And Dr. Noble mentioned the 1918 influenza pandemic. And in that, the peak was a similar time frame as the peak of COVID. There are, of course, several differences between the 1918 pandemic and what we have today. But the thing that I wanted to make note of is that during that time, there was a start to decrease in number of infections, and come April, May, June, it kind of tapered off as the summertime rolled around. But when the wintertime hit, it came back around, and that's something that we have to make sure that we're having these conversations with our administration staff, with changes in the way that that medicine's practiced, and the changes in business structure now, because this probably is going to kind of swing on an uptick toward the end of the year during this wintertime season, November, December of 2020, and we need to be prepared for it. And you fool me once, okay, shame on you. Fool me twice, shame on me. So I think that utilizing the information that we have and what we've learned so far is to help us to construct a platform or construct a system in order to keep us all safe. And what I would like to say that all the people that are watching that are non-physicians or non-practitioners or non-health caregivers is that there is a enormous amount of false information that you can get your hands on. So please do your best to make sure that the information that you receive is vetted or at least administered by a reputable site, so that you can arm yourself with the appropriate information to keep you safe. as opposed to some of the, the foolishness that you can see out there.
Hey, Don, I just want to thank you and the rest of the panel for this. This was great. COVID-19 is going to serve as that slap in the face for America to wake up and for us to have a healthcare revolution. And this time the revolution is going to be televised, and it's going to take, individuals like this in this room, as well as the other panels that you've had before. And so everyone just mask up and make sure that you try to stay as abreast with the information as much as possible. You guys can follow me on Twitter at Dr. Steve MD, DrSteve MD, and look forward to hearing from you guys soon.
Hey, Don, I'd like to thank you for the invite. It's been an honor being a part of this panel. Just echo what everyone else said. I don't want to make this too long, but just for the viewers, just wanted to give a little, leave on a positive note that, just stay prayed up, have faith, and just know in the end, this too shall pass. And, just do the common sense things, wash your hands, stay away from everybody, don't touch anybody, don't anybody touch you, and it'll all be all right.
Yeah, all I want to say is, look, fool, what did somebody say? Fool me once, shame on you. Fool me twice, you can't fool me again. That's one thing. And then the other thing is, like you said, it too shall pass, but regardless, it just gives us more incentive to live our best lives. So whatever it is, whatever your wildest dreams are, sometimes the greatest creations come in the darkest of times. So, as we're speaking here, we're brainstorming the things we can actively do in our community. Trust and believe. There's some kids somewhere with the gas cut off, but he got a light bulb somewhere, and he's trying to cook up a cure for everything, or at least some concoction of vaccination. So I always try to, I tell my patients that, when they're, in their darkest of moments, you always got to look up, and, of course you seek your source of prayer and inspiration. But, when you keep a positive mindset, some of the greatest moments come from those times. So.
Amen.
My last thing I'll say is, just first and foremost, just piggybacking off of Dr. Will and Dr. Serge, again, you can only worry about the stuff that you can change. I tell my patients this all the time. They come in worried about all of these things that you have no effect on. Like, if you got to go to have a C-section, or you got to, like, acts of God, and things that are happening around you, all you could do is do your part. At the end of the day, thy will be done. Like Dr. Will just said, man, this too shall pass. I've been saying that forever. We don't take it lightly, but what's gonna happen is gonna happen. But this is gonna pass like everything else. So everybody, breathe, relax, listen to what the advice is, and do your part with that is concerned, and everything else is going to happen the way that it needs to. But on a larger scale, I just want to say, again, thank you very much, Dawn, for putting this together, and just speaking on behalf of, myself and Max. We go all across this country talking to, young Black kids all throughout the country. Our book, Pulse of Perseverance, did well, but we try to give back to these kids. And the biggest thing that we see is that these kids are seeing no, evidence of, Black excellence, right? And to have all you gentlemen, on this panel, like, this is just, I don't care what we're talking about, but just to have all you accomplished brothers on this panel, this speaks volumes, man. And just the imagery that this has on our future generations, man. It's like, it's y'all just don't understand how impactful it is, man. So, as we leave here today, man, I challenge y'all, I challenge everybody just watching, that we got to do this more often. Like, if nothing else, we have to show these kids that, they have more to aspire than what the media is portraying, man, because people not going to show this. I say all the time, positivity is not popular. This type of stuff should be broadcasting on CNN and stuff like that. You're never going to see that, but we have to make this the imagery for our kids to understand that, it's nothing else going on positive around you. You don't see any of that stuff, but it's here. Like, we not anomalies, man. We out here, but we have to have more of a uniform voice and be a reflection so that these kids can have something to aspire to, because they all ain't gonna be able to play in the NBA. They are, you know, one or two of them gonna be able to do the next Beyonce, but all of them, they can control with their minds. They can control their future, but they have to be able to see it, man. If they don't see it, it's hopeless, man. So we really have to, you know, after this is done, man, link up with each other, and link up with other brothers and get this going, man. And if nothing, if COVID, like I said, if COVID has done absolutely nothing else, it's shown us what this country is lacking in. It's made us come together and look at things introspectively of how we can improve the world around us from a health perspective as well as from a societal perspective. So yeah, so you know, do more. I'm challenging. I challenge myself every day. Do more. We got to do more, and we got to unify.
Amen. Anyone else? So everyone, I actually have your websites, your emails, all your information for the community to see. These are for people who are actively in I mean, you still have a lot of people here supporting you, listening to you, excuse me, even the people that see this on the replay, they'll have direct access to you. Okay. So I know that some of you have mentioned your websites, your basically IG accounts, all that is actually found right above below, the title of the Facebook Live, you all. So make sure that you go to those particular individuals here. If you have any particular questions, we have a lot of people here that are on private practice that are still open, that will love your business. We have individuals who have brands that will love your business as well. And this is not the end. This is not the end. And I declare right now that we will be on a national network very, very soon because people need to hear this. So it's going to happen. I declare that.
Amen.
We're all going to be there. The women, the ladies, we're here to support you, brothers. We are here. And I know I speak for every single sister there that is listening to the sound of my voice, that we are here to support you all. So whatever we can do to help, we're here for you.
Appreciate it.
Appreciate it. Thank you.
Thank you all. Thank you so much, Dr. Brown,
Thanks,
Dr.
Don.
Pierre, Dr. Jones, Dr. Pryor, the doctors, Mad Hair, Dr. Noble, Dr. Brad, Payton, Landrum, Johnson, Darko. Wow. Y'all brought it. Y'all killed it. Thank you so much, gentlemen. Thank you, thank you, thank you. And I know this is not the end. Thank you all, the community, for listening. And please continue.
Y'all be safe, man. God bless.
Bye-bye.